Would you like to learn a practical new skill for your sciatica patients? If so, you're going to want to check out this blog. Hey, it's Tim from ChiroUp, and this week we're discussing sciatic nerve flossing. It takes advantage of the thought process of neurodynamics, meaning that healthy nerves need to glide and stretch. They're not like that piece of beef jerky that we saw in the anatomy lab back in school. It's more like a bungee cord that has to slide and stretch the whole distance. Imagine we had a 4-foot-long bungee cord and we pulled on it. It would disperse the stretch throughout the whole cord. But if we stapled that cord down 6 inches from the pull, now all of the pull takes place in that short section of nerve, which creates more traction. And nerves don't like traction because it causes ischemia, and they don't like compression because it causes ischemia. So they complain, like sciatica. How do those nerves get adhered in the first place? Well, one thought process is anytime that there's irritation at the nerve root, that causes the whole nerve to be swollen. We know that's true. And the theory is that that swelling then forces fluids out because there's increased hydrostatic pressure in the nerve versus the surrounding tissue. Well, that fluid is sticky and eventually turns into weak bonds that staple the nerve down to that location, causing the problems. So how do we define if that's a problem? You're already doing it. You're doing neurodynamic tests in the lower extremity called the straight leg raise or Bragard's test or slump test, things that often stretch the nerve and a lot of times stretch both ends of it. The difference between the sciatic nerve stretch or any type of a nerve stretch and a nerve floss is that a floss stretches just one end as opposed to both ends. So when we do a tension test, if we're going to do a slump test, we'll perform a straight leg raise and neck flexion, stretching both ends of the sciatic nerve. If we're going to floss it, we're going to stretch one end at a time. So imagine that we have a shoelace in a straw and then we've squirted some weak Elmer's glue into that straw. That means that now it doesn't move as freely, and in order to free that up, we'd pull one end while we release the other, flossing it back and forth. That's how nerve flossing works. So we can stretch the top or relax the top, we can stretch the bottom or relax the bottom, but we do those in alternating patterns. You can do that in your office, and you can send the patient home with this. Simple skills that you can teach your patients to improve their outcomes. I hope that you'll check out this week's blog on sciatic nerve flossing. We'll go over all the details for ways that you can help get better outcomes for sciatica patients. Thanks for watching, and I hope you like the information that follows.